Hi everyone, I'm James Barker and I'm an Associate Publisher at F1000. Today we're going to be exploring how we can go about implementing these evidence-based research processes from a publishing perspective using the 4 statements from the 2016 Lund et al. Paper as our framework for that. So, as an initial step, wanted to do some sort of scene setting. So first of all, as mentioned, those 4 statements are coming from that 2016 paper from Lund et al. In the BMJ. And since that publication, I think we're all aware that these practices have yet to become standard. And equally, they're not something that we currently implement at F1000 in our guidelines or policies. But it is worth stating that it's not out of the fact that it's a bad idea. It's when you talk about the concept and the argument for it, it's one of those ones where when you talk about it, people say, oh, why aren't we doing that already? So there's clearly not a problem with the idea, it's a problem with implementation. So what are the things that we can do as publishers to facilitate that uptake? And that's the question that I've been asking myself when writing this presentation. And the conclusions that I came to were ones that it could work well in principle, and there are some potentially immediately actionable things that we could do, but how do we make it practical? And that's something that we're looking to explore. So first of all, just to highlight those 4 statements that we're going to be talking about to provide that context. So when I look at these, I sort of split them into the top 2, which are focused on the current research paper sort of being described, and you're looking at rationalizing the design and also the result in the context of the existing literature that's been systematically reviewed. And then when we look at the second side of it, where we're looking at potential future studies, we're looking to ensure that any future proposed study takes into account current and past research, as well as ensuring that it is properly categorized and defined in terms of those population interventions, the comparisons, outcome measures, but also the study types that are looking to be conducted. So first of all, I wanted to have a look at how we could go about doing this in principle. So my first action was to sort of look at the 4 statements and look at practical ways that we could address this immediately at F1000. And as a ex-editor at F1000 as well, someone who used to edit these papers, I thought, how can I integrate this into sort of the workload that we do sort of day to day on any of these given articles? So to address the first point, the easiest idea was just to ensure that a systematic review is mentioned or cited in the introduction, would go some way to achieving that point. The next bit would be something that felt a bit more appropriate for the reviewers to be involved with, and that'll be to ensure that if they are describing that previous research, is the description sufficient and sufficient enough, and ask them to comment on that. In terms of the third point, looking at whether the new proposed studies have been proposed in the context of previous studies and making sure those citations are there. Again, another role for the editors. And then the final one I felt was potentially another one for the reviewers, whereas we'd ask them to ensure that the correct PICO terms have been defined, and also the study type, etc., has been defined for that future research as well. So with that in mind, those are 4 very easy things that we could do straight away. But the question was, as publishers, there are probably some other questions that we need to answer first before we can start to implement that. And one of the ones that was key to that is looking at what do we do when they aren't addressed. So we have this role of publishers acting as sort of like the gatekeepers and making sure that we're only publishing the best of scientific work and ensuring that it's scientifically sound, etc. So it's important to consider the decisions we would have to make in light of that process with these new concepts. And first of all, if we're going to say that this should be standard practice, does that mean that we should be rejecting an article that, for example, is completely scientifically sound but doesn't conform to those evidence-based research practices? Well, that's the first question. Next question would be, how do we assess the quality of the evidence base? If we're going to require this to be the case, should we be delving into the systematic reviews that have been cited, looking at the evidence base there? Are the arguments they're making based on a strong basis of the evidence? If not, what do we do in that case? And the next thing is the evidence up to date? We facilitate the publication of systematic review, living systematic reviews. Should we be favouring, say, living systematic reviews over a traditional systematic review, as that's providing a more up-to-date view of the evidence at the point where that article is being published? And also, if it doesn't conform to the 4 statements, should we reject it? Is that grounds enough for us to reject an article? And what this all leads back to is an issue that we commonly have with these new concepts in publishing is we're dealing with the publication right at the end. So should an editor or reviewer make an assessment when the work has already been done? And that is the question we need to answer. And the problem is it's a problem of timing. As publishers, we are seeing the work in an article once it's all been completed. So if we're then to turn around and request that the author includes all these evidence-based research approaches at the very end, that's quite a difficult undertaking to make. And that's the thing, and this is the argument you'll hear from publishers for a lot of these concepts, is that we're stuck right at the very end, and it's very hard for us to drive change when we're dealing with an end product. And there's some validity to that argument. So, okay, where else could we be looking to look for input on implementing such a policy? Well, the potential other place to look would be the funder. They're the ones who are funding the research. They're the ones who are involved at the very start. Could they be using mandates and incentives towards their grant holders to tell them to conduct their research in a certain way? There is an argument that some grant and funders already do this at this point with stuff like OA mandates, for example. So could we expand this out to things like evidence-based research practices? But then there'll be an argument from others that says that a lot of funders don't want to be that actively involved in dictating where the research goes. They want to allow the authors the sort of scientific freedom to go about and do what they want to do. So then at that point, it comes down to the classic one where it was relied on the author to make all these decisions. The argument is that the author is involved in the process from start to finish. So therefore, they should be making these decisions and should also be the ones that are driving the adoption of these new processes, such as evidence-based research practices. But again, this is too much of a simplistic view. This is, and it also shuns away. And this is another area of it where it's also about accountability. The argument is that because the authors are involved in the whole process, they have the most accountability, so they should be driving it. But then that fails to look at the fact that these authors need to publish in journals and often in high impact factor journals, so limiting their pool even more to progress their career. And then when the funders then go to look to see who they're going to fund in their next round, they're looking at what the publishers have accepted and where they've accepted it to make a decision on if a given author might receive that grant. It's not a linear process where we can say that certain aspects are the responsibility of certain people. It's a completely different and non-linear relationship. And this is something that was highlighted by the authors of that same paper that the 4 statements came from. The fact that it is crucial that not only researchers, but all other key stakeholders in the scientific process acknowledge their responsibility for evidence-based research. So taking that concept forward, this diagram maybe is a better representation of what we're looking at and what we're discussing. All areas of the sort of research life cycle, the publishers, the funders, and the authors are all involved and all are involved with each other. It's not just we're involved at one point, you're involved at the other. They're involved at all stages in various different guises. with publishers, the most obvious relationship with an author is those publications, but we can work with them on other roles such as reviewers or as editors. You have looking at funders, they work with publishers to develop their own publication venues, some of which we run at F1000 for a number of funders, but also through other things like discussions on new policies, on how to go about implementing open data and OA, various different conversations. And obviously, with authors and funders, the most obvious relationship is with grants, but there are also other activities where they can get involved. So if we were to take this model forward and apply it to EBR, I thought it would be useful to contextualize this in an example of where something like this has worked well. So the example I'm going to draw on is from Wellcome Open Research. This is a Diamond open access publishing platform specifically for Wellcome funded researchers. And it publishes fully open access, but it also publishes with an open data mandate. So with that in mind, how did an open data mandate, something that classically is quite hard to implement, is quite hard to get people to conform to, and also is limiting the number of publications potentially for a publisher, how did this become successful? Well, number one, you had the publication venue that was set up for that particular purpose. It's a publication venue specifically for Wellcome grant holders. And the policy was mandatory. So that was immediately established and it's just part of the framework of that given publication venue. In terms of the funder, Wellcome have a mandatory OA policy, and they also encourage data sharing amongst their grant holders through various things like awards to try and draw people and push people towards sharing their data. And then if you look at authors, they are incentivized through various means. So you also have those awards I mentioned, but also the fact that they're not involved in any way in terms of the payment on a publication on Wellcome Open Research. Everything is handled for them, and Wellcome are the ones that cover the APC. So it's a very simplistic, easy publication process for them. And what you have there is you facilitate a venue that allows and supports the policy, a funder that pushes their grant holders towards it, and then authors that are incentivized to use it. And that relationship has worked extremely well. And now we're in a situation where Wellcome Open Research is the #1 publishing venue for Wellcome funded research. And it has been for the past couple of years. So we can see that this model can work. So how could it potentially work for evidence-based research? Well, #1, you need to look at potentially setting up a publication venue that facilitates evidence-based research, potentially through mandates. And then in association with that, you probably need a funder that is either going to mandate or incentivize those practices being used by their grant holders. This is something that I think that some funders are doing already. And then from an author perspective, there's the requirement to conform to those practices when publishing and applying for grants. And then also citing work where those practices are used and supporting publication venues that facilitate that. And that way we can work into that similar cycle like we had with the open data policy of Wellcome Open Research, where because everyone's pulling in the same direction, it's much easier to reach that critical mass and get people involved and engaged. And that's what it's all about. It's all about everyone needs to buy in. It can't be just one single aspect of this pyramid. It can't be a single group of authors or a single funder trying to push it forward. If you have a publication venue that supports it, but nobody publishes in it because they don't want to conform to those practices and funders don't support it, that publication venue will fail. If a funder mandates the use of these practices, but there's no publication venues available to support it, all you're doing is pushing your authors to form a load of practices that might preclude them from publication in a range of venues, and therefore is almost punitive in that sense. And then if you look at an author, authors can conform to these practices, but if there's no venues for them to publish that work in, and also their funders aren't supporting them in doing so, they're going to really struggle to publish, and that's going to affect their progression through their career. So that's the key thing. Everyone needs to buy in. So moving from the principles to potentially how could we look at doing this in practice. And I thought a key aspect of looking at those 4 statements and the expectations from from editors, I thought there are some key questions that before an editor can be expected to ensure that they're conformed to, they need the answers to. And the first of these was when. When thinking for myself, when I was an editor, if I was to pick up a paper, which topics and which study types are relevant for these policies to be applied? Is it every single one? Is it every clinical article? Is it every preclinical article? Are translational research papers sort of in this scope potentially? When should I be asking the question? And then once I know when, what should I be asking? Is there a minimum standard of reporting that I can use as my sort of North Star? Do I know exactly what a good evidence-based reported article looks like? And then once I know that, it's how do I ask those questions? Is there a set standard for how this should look that I can then use as a checklist to question the author, to ask them to provide more detail? Can this be formalized into a reporting standard, something like a Prisma or a Consort? And then who should be responsible for these questions? Should it be the author when they're writing it? Should it be the editor, myself, potentially, when I'm reading it and ensuring that content is there? Or is it the reviewer at the point of that peer review process? Arguably, I think you probably want to end in a situation where something like Prisma or Consort becomes mainstream, where everyone knows that it has to be conformed to. So therefore, the author is writing their paper with it in mind. The editor is looking at that paper, knowing that they should have conformed to it. And the reviewer is reviewing that paper, knowing that this has been used to write it. So then it's about bridging the gap. Once we've answered those questions, how do we go about building and facilitating evidence-based research publications? So from a publisher perspective, we'd start off by piloting these practices in publications, providing a venue for people to try out those processes, a bit of trial and error, get that feedback and use that to improve processes going forward. Additionally, we could do a survey of our existing content and look at EBR compliance. If we are seeing particular fields, for example, that might be very compliant with it, what can we learn from those fields and draw into other areas to improve the overall uptake of EBR? And then looking at the visibility of articles that are highlighting the underlying issues, so particularly things like research waste, making sure that those articles are put at the front of the shop so people can read them, people can see them and understand what the underlying problem is, get that into the forefront. And then also, and I think this is very important, is increasing the visibility of articles that are doing it well. And that way, by showing those as that sort of North Star, as that gold standard, help to drive that adoption. From a funder perspective, incentivizing the research and publication practices around EBR is important. Also, potentially implementing this into your grant process, which is something that some funders are definitely already doing. And then also looking to work with other funders. So it's not just one funder in isolation, but a conglomerate, a consortium where they can come together and say, this is the standard that we expect as a group, and therefore this becomes more standard. And even when people aren't applying for other grants that might not require this, they might just become standard process. And then from an author perspective, supporting publication venues that facilitate EBR. And I think that is really important. You, as authors, are the market to publishers, and the majority of academic publishers are businesses. And therefore, you're the market. If you can create a significant market pressure by publishing in a journal that facilitates evidence-based research, then that will be noticed by the business, and they will either double down and try and increase resources into that journal to increase the number of submissions. They'll potentially look to see if other journals in their portfolio might be able to do similar things to get a piece of that, or set up entirely new publication venues that are focused on that aspect. But that process will never begin unless there is a demand created. And unfortunately, as is often the case, that requires authors to provide that demand. But then again, and additionally, in tandem with that, is also providing people with a framework to be able to go away and facilitate these EBR practices through things like guidelines and reporting standards. And these can be really helpful in also driving that forward. And again, it all just comes back to building that buy-in across all parties. So in terms of answering the 4 statements on the expectations from editors, I think what we can see is that expectations are key. at the moment, there's probably a lack of expectation in terms of these being the main way that we go about publishing it. So from a funder's perspective, we need them to be expecting to see the systematic reviews on that proposed topic when somebody applies. From an author perspective, they need to expect that they will need to provide that content and from those 4 statements. But additionally, they should expect to see the same in what they read. If they have that expectation and cites the work that uses those practices and increases their popularity, that will help to push forward the narrative and push forward the process to getting more universal adoption. And from a publisher's perspective, we should expect that our readers want those EBR methods and facilitate those expectations. Editors should be expecting authors to provide that content, and then reviewers should be expected to evaluate if those methods have been applied properly. And by creating that expectation, that drives the adoption. So in conclusions, it's one of those things. It's hard to keep a good idea down, and this is a good idea, and it just needs a bit of facilitation. But it's important when we look at that in terms of facilitating that through scientific publishing, is that we don't look at it in a vacuum. It requires that buy-in from all stakeholders, and we need to drive and create that expectation that will drive adoption. So thank you very much for listening, and I'm now happy to take any questions. Thank you very much.